Let me begin today by thanking all of you for being here, for caring about mental health services in the Commonwealth, and to make sure that we collectively today send a message throughout Beacon Hill, and yes, to the Department of Mental Health, that we need to stop the cuts in mental health services. We need to stop the closing of Taunton State Hospital. We need to start studying our comprehensive system.
In 1990, I was diagnosed with manic depression. I struggled with the illness for decades. I doubt that your $300 million state-of-the-art facility in Worcester can provide the intense care and treatment that I received at Taunton at a time when I needed it most. If Taunton closes, the patients will suffer an immeasurable loss. The entire staff at Taunton was there for me in times of trouble. I can remember crying on Christmas, hiding behind my present given to me by the Friends of Taunton State Hospital with tears streaming down my face. I remember being consoled by the staff. I felt that strong arm on my shoulder many times at Taunton. The nurses and mental health workers were with me through the entire intense course of treatment. If it weren't for Taunton State Hospital, I simply wouldn't be here. I was given a whole new lease on life. I was treated with humanity and dignity despite the difficulties I faced.
After almost a year and a half of stability, I was ready to move on. On May 25th of 2011, I was discharged from Taunton State Hospital. I have since been able to maintain my recovery, and with the help of community counseling of Bristol County and community-based flexible supports, I've just moved off of a group living environment, moved out into my own apartment. And I would not be standing here today if it weren't for Taunton State Hospital. I was a substantial part of my recovery to the modernized and very non-antiquated care and treatment for my diagnoses that I received at Taunton State Hospital. My success story is but one of many.
If you want evidence of the total failure of our state's mental health system, come to any emergency department at any time and ask us how many untreated psychiatric patients we are holding in REDs on any given day. For me, that number can run from 6 patients all the way up to 21 patients. 21 patients, untreated psychiatric patients on one day that I went to work in a 20-bed emergency department. These people should not be in REDs, at least not for days and certainly not for weeks. It's unethical, it's criminal, and it's a travesty. We certainly need to stop the closure of any psychiatric beds or services in this state. We need the experts, and not the Department of Mental Health, to study this problem and come up with a real plan and a fully functioning mental health care system to address this crisis and help one of our most vulnerable populations.
It is no exaggeration to say that we have no mental health care safety net in Massachusetts. There are not and have not been enough beds or community-based services in the system for years. The decision to close Taunton State will only exacerbate a long-standing crisis. This has gone beyond an issue of funding and finances. This is a moral and ethical issue of human rights and common decency.